Emma!
Yes.
Oh, good. I haven't seen you since your holiday.
Oh, hi, Valerie. I'm sorry. I really need to take this.
Of course.
In private?
India? Please, India. India, please.
So, how are you? Since Lena, I mean.
Fine, thank you.
Her going back to her husband like that must have been a terrible shock for you.
Well, not completely.
So, do you think it was just a passing phase for her then?
Well, you'd have to ask Lena about that.
And what about you? Are you actually a lesbian now, would you say? Or do you think you'll go back to men?
Give it a rest, Valerie. I mean, she's entitled to dabble.
Actually, Valerie, I would rather that my private life was not dragged through the workplace.
Oh, sorry. I didn't mean to offend.
Excuse me, there has been a mix-up with the rota. I need someone to cover the campus surgery this morning.
I can do that.
Oh, well, thank you, Dr. Reed.
Yes, I'll be on my way.
Let me in. I've seen him. He's been following me.
Go away, please.
I've managed to ditch him, but I don't know how much longer. Don't be a total idiot. What do you think's going to happen?
Please, Kaz, I'm not well. I can't do...
What's wrong with you? India?
If you don't leave, I'll scream the whole place down.
India, this is me you're talking to. Why are you acting like this? Just let me in and we can sort this out.
Help!
Don't... Okay.
So just ask her how it went. You're dying to know.
You ask her, woman to woman.
You sexist.
Mrs. Tenbay, I have typed up the minutes of the last meeting.
Oh, thank you, Miss Pittman. Good morning, Dr. Carter.
Morning, Mrs. Temby. How was the book festival?
Oh, it was wonderful. Thank you. Some very interesting speakers.
Good. Did you enjoy the...
Good morning, Dr. Heskey. How are you?
Great, thank you.
Are you bearing up?
Very much so.
Morning. Times like this, important to share.
Yes, well, we all find our own way to grief.
He needs bringing out of himself
Well, I'm not sure that Al necessarily...
by someone who has lived under the shadow of death themselves.
You okay? I'm Dr. Reed. All right. Okay. Can you tell me your name? It's India, isn't it? India Jepson? All right. Okay. Just relax. It's all right. Okay.
Sorry.
Don't be sorry. How long have you been feeling like this? All right. Easy now. Easy now.
Can you give me something for the sickness?
Well, I'd have to examine you first.
No, actually, I'm feeling better now.
Okay, well... Oh, are you getting stomach cramps? All right, come on. Let's get you inside. Come on, let's get you inside. There we go. Gently now. Come on. Come on. All right, easy does it. Count, can you get me a sick bowl?
Oh, yes. Oh.
Okay. Have you eaten anything out of the ordinary in the last 24 hours? No? All right. This is India.
Oh, India, would you like a glass of water?
No, I think it's straight to sick bay.
All right.
Come on. That's it. Just relax. Okay.
Do you need a hand?
No, I'm fine, Karen. Thanks, though.
Okay. I'll leave you be.
Thank you.
Okay.
All right. Okay, there you go. Just relax. Don't panic, it's all right.
I'm really sorry about this.
Don't be daft.
You must be busy. I'll be fine, really.
India, have you had any diarrhea at all? Okay, when did the symptoms start?
I started feeling a bit queasy yesterday. Started puking in the night.
Okay, your pupils do seem quite dilated.
So tired.
I'd like to keep you here for observation, just for a while, all right? Is there someone I can call? Are you in touch with your family at all? I'm sorry. Well, a friend perhaps?
No. I don't need anyone.
Okay. How are you getting on at Haverston House?
Okay. Actually, I've moved into halls.
You're at uni.
Doing sociology.
That's fantastic. Do you feel safe in halls? Good. I'm so pleased that things have moved on for you.
You were always really kind.
Okay, all right, don't panic. There you go. India, have you been around anybody who's had a sickness bug?
No. I'll be fine. Just lie down a sec.
All right. Okay, well, look, give me this and I'll get you a clean one. And let's get you.
She said she enjoyed the speakers. You didn't even ask her about Charles, did you?
I read between the lines. Men can do that too. I think we should get the four of us together again.
Oh, yeah, we could do another theme, like, why not Kramer versus Kramer this time?
You're really not forgiving me for Casablanca, are you?
It's fine, you know, Heston, I don't mind being your unpaid skivvy and while you just stir the
Do we have to have this argument? I just think they make a rather good couple.
Yeah. Yeah, Charles is quite smitten by her, isn't he?
Come in. Hi.
How's the vomitor?
Oh, yeah, okay, I think. I've put her in sick bay. I want to keep an eye on her for a little bit. She's a sweet girl. Had a rough time of it lately. I had to refer her to a women's refuge not long ago. But, you know, her life seems to be going in the right direction now, thank goodness.
And how are you doing? Hardly saw you all weekend.
Great. How was your weekend with Sierra?
Yeah? You're not still blaming yourself about what happened with Lena, are you? Because Lena made her own choices.
Of course not. Look, Aisha, I've got a lot to catch up on.
Emma, you do know you can talk to me
Yes, of course.
about Lena or anything.
Yep.
Oh, Al. I just wanted to say I do understand what you're going through. It's hard to talk to anyone at the moment, isn't it? I closed down too when people tried to reach out to me, but believe me, it's only when you share your pain that you start to realise it's all part of the circle of life. So, when you are ready to talk, I'm here for you.
Valerie, you do not know how I am feeling. I have no interest in you sharing my pain. See, this is not about you. I'm sorry, but it is not about your cancer. So you save your inspirational Disney quotes for someone who doesn't see them for what they are. Okay?
I was talking about losing both my parents, not about the cancer. They both died a while back. It's strange being an orphan at any age. But if I've spoken out of turn, I'm sorry.
Valerie, I'm really sorry for your loss.
Hi, can I help?
Hi.
Oh, that's a nasty one.
Yeah, I'm looking for my friend, India Jepson.
Sorry, I can't give out patient details.
Of course, it's just that she called me, said that she was here. She's not very well. Totally get that you can't break confidentiality. It's just that she sounded really rough, and I'm what she's got these days. I didn't like to think of her here on her own.
What's your name?
Cass.
Kaz. Okay, you stay there. I'm just going to have a word with the doctor.
Sure. Thanks so much. Hey, you followed me. What happened? What do you think? Oh, Cass. What's up?
Some sort of bug, I think.
When did that begin? Come on, India. I'm worried about you.
You're worried about yourself, more like.
What have you told the doctors? You can't stay here. He's looking for you right now.
Oh, I told her to wait.
Come on. I said I don't want it. Leave me
alone.
Just take it. Just take it.
Hey, I told you to wait outside.
What's going on?
Well, she was calling for help. I couldn't just leave her.
I wasn't.
Okay, I think you better go. India?
I need the loo.
I'll go. Turn left. Downstairs.
Oh, she's in a right state, isn't she? I wonder what it is.
What's happened to your face?
Oh, stupid. I banged it on a door.
Well, would you like me to take a look
It's
at it?
fine, really. Do you think she could be delirious?
I'm sorry, are you a good friend of hers, or...?
Oh, besties for ages. More like sisters. She kind of depends on me. Honestly, I don't know what's got into her. Maybe it's the illness. She did seem weird on the way back. Maybe she was coming down with something then.
Way back from where?
Europe. Backpacking. I've always looked out for India. What with her not speaking to her parents anymore. Helped her when her ex turned violent, got her applying for uni, found her a place in halls. I don't want some stupid row coming between us, Doctor.
Of course not.
We've always done everything together. I don't know what's gone wrong.
Well, friendships can be complicated, can't they? Look, tell me honestly. Your face. That isn't anything to do with India's ex-boyfriend, is it? I mean, he's not back or anything. Because I was one of the people that helped her get into the refuge, so...
Will you ask if she'll see me, please?
I can ask. Let me see how she's doing.
Dr. Haskey will be with you shortly.
Thank you.
Ah, Miss Pittman, the minutes you provided were excellent, most thorough.
Really?
Oh, absolutely.
Thank you, Mrs. Temley. Certainly nice to be appreciated.
Mr. Burton, James, do you want to...
Is there anything else I can help you with, Mrs. Temley?
No, that will be all for now. Thank you. Well, actually, perhaps you could write up the minutes of the last few meetings. It would be very much appreciated.
Of course, Mrs. Temley.
I can't guarantee that she's well enough to see you, even if she is willing.
Of course, Doctor.
India?
She's feeling a bit better, so...
Oh, that's good. Where'd she go?
Who, that Kaz? Not sure how much of a friend she is. India said she didn't want it anywhere near her.
Right. Okay. Well, thanks, Karen. I'll take it from here.
Okay.
India? India?
I don't want to see her.
Kaz isn't here. She's left.
Are you sure?
Yeah. What is it with you two?
It's nothing. Girl stuff.
Did you fall out when you were travelling together? She said that she thought you looked unwell when you were coming home.
It was her idea. I didn't want to go to Thailand.
Thailand? Oh, India, if you've been to Thailand with your symptoms, I need to do a blood test just as a precaution.
Honestly, there's no need.
I think I should take you to St. Phil's.
No, you can't really. You can just take a blood test here, can't you?
Well, look, if you're worried about Finley finding you, I promise that won't happen. I will make sure that you're safe. You can trust me. Yeah? Good. Come on. Let's go back upstairs.
PPG meeting's going to get heated. When I see the broken toilet keeps getting shunted to the bottom of the agenda.
I just didn't know that minutes could be so fascinating.
Oh, you'd be surprised.
Got the secrets of the practice there, Valerie.
Oh, I have, Dr. Veer. Mind you, my lips are sealed on the next one. Patient complaints.
Oh, hopefully that's only a brief item.
Oh, I couldn't possibly comment.
Let's hope you're not on the naughty list.
Okay, India, right, this is just a routine blood test, all right? All I'm doing is to check for possible causes of infection. Okay, nothing to worry about. I'm going to test for Hep B and Hep C and malaria. Were you taking malaria tablets? Okay, well, luckily, Thailand's very low risk for malaria.
Sure, I haven't got anything like that.
No, I'm sure you haven't, but it's just good to check, all right? Okay. Now, have you had your Hep A vaccine? Are you up to date with your tetanus?
I think so.
Good, all right. Just a little scratch. All right. There. Well done.
It's stuck in you?
Yes,
It's okay, I'm sure I'm clear. Dr. Reed, I haven't... Hold on, let me get someone. It's Dr. Reed. She needs some help in there.
What is it?
The needle is stuck in her.
What? Come on. Let's get you sat down. Come on.
She was always kind. Big mistake.
You put it in your mouth.
Yeah, it was just a reflex. I didn't think.
Chances of contracting something are still pretty low.
Yes, I know that, but she's just come back from Thailand, hasn't she? Which is why I'm doing the blood tests.
Right, I'll get the test form sorted, get you up to St. Phil's straight away. Put your mind at rest.
I need some help in here.
I'll go. India, she's just collapsed. India, can you hear me? Ambulance. India.
Ambulance, please. Hello, yeah, could we have an ambulance, please, to campus surgery? Yeah, the patient collapsed.
They're coming.
She's conscious.
Who's coming for you?
But she's kind of drowsy.
All right.
A needle stick? Well, how did she manage that?
I'm not sure how it happened. Unfortunately, she put the injured finger into her mouth.
How absurd. Sucking her finger. She's had the training, hasn't she? What is she, a grown woman or a toddler?
Dr. Carmichael, the patient in question has collapsed. She's been rushed to St. Phil's. So, can you cover at the campus?
Yeah, okay.
Yeah, a little empathy would not go amiss. Dr. Reed was very upset.
Of course, Mrs. Tempe. I do not need instructions on empathy.
Kaz? If you know what's wrong with India, now is the time to say.
I don't. Honest.
They're going to find out at St. Phil's.
Did she say anything to you?
Why are you asking?
I didn't mean for her to get sick.
I mean, just because I don't sugarcoat it, I can do empathy as well as anyone else. If not more so. Daniel!
Of course you can, sweetheart. Who said you couldn't?
Mrs. Tembe.
She didn't.
She implied it. You're going to have to pick Joe up, by the way, because I've got to go over to the campus to cover for Emma, some ridiculous needle stick injury.
Oh, no, poor Emma.
I mean, you think she'd have more wherewithal than to... Yes, you are right. I do think she's all right.
You little beauty.
What's that?
This is something for the camping trip, little orienteering.
Orienteering?
Yeah. Must have been a girl badge for that. Didn't you get yours? Oh, look, we're going to be able to find some fantastically challenging terrain with this.
Darling, this is a family camping trip, not some Ramirez survival course.
Yeah, but I thought it'd be a really good idea to drop Joe off in the middle of the woods and give him this and the compass and see how long it took him to get back to the tent.
If you think I'm going to allow a 5-year-old to be left in the middle of...
Hold on. That was humour, obviously. No, we will all get lost together. We will have some family bonding time and some navigational skills to boot.
What larks?
You're having second thoughts, aren't you?
Don't be so ridiculous. I can't wait.
I can do that. Why don't you get yourself a cuppa before Zara arrives?
No, I'd rather be busy. Oh, Aisha. I feel so stupid.
Emma, don't.
And I can't even take a simple blood test without putting myself at risk.
Come on now.
India ran away from a violent boyfriend not long ago. I'm worried he's back. And they were arguing about something when I came in.
Laxatives.
CQC inspection. We're going to have to be on our toes.
So, Valerie, am I really mentioned all that much?
Dr. Veer, Mrs. Tembe has entrusted me with this task. I could hardly break confidentiality.
No, of course not. I was only wondering. Mrs. Hawkins?
Still better to be talked about than not talked about.
What?
Well, take it as a compliment. If your name's mentioned once, it's mentioned a dozen times.
You are joking, aren't you, Valerie?
I couldn't possibly comment.
If you'd like to just come on through. Thank you. Thanks.
Why was her friend hiding?
I don't know, but she looked terrified as well.
Where's Emma now?
Consulting room.
Hello again. Right, so when is it likely that there'll be more news?
I'm sure there's no need to panic.
So you'll let us know? Yep, I'm bringing Dr. Reed in now. Cheers. Bye.
Well?
India's no better. They've taken blood, so until the results, malaria's still a possibility.
Malaria's easily treatable, isn't it?
Yeah. It's Hep C we need to worry about.
Okay, well, I think that's everything. So I'll see you in 2 weeks, Miss Hawkins. Okay? Bye.
All they're saying is they're not ruling out Hep B and C, but it could be gastroenteritis, food poisoning. If it's malaria, then...
I just can't stop thinking about the laxatives and the fact that she's just come back from Thailand.
I know, but let's not go there. Not yet. Not before we know.
India? Are you taking her to theatre?
Stay here, I'll find out what's going on.
Well, they've got to screen the girl too, so could be a while before there's any more news.
Dr. Reed is very worried.
Yeah, well, you're always going to imagine the worst possible outcome.
And you'll keep us informed of any development.
Oh, yes. Yes, of course.
On a lighter note, Rumour and I were wondering if Charles and you would like to join us for a concert next time, since the Casablanca evening was such a success.
Well, that is a wonderful thought. Oh, I cannot speak for Mr. Gupta, but I myself will be delighted. Thank you.
Lovely.
What?
I thought it was just going to be us two.
Any news?
Emergency surgery.
Why?
They've found a foreign body in her intestinal tract. Look, even if she is a drugs mule, she's not necessarily a user.
It's pretty likely, though, isn't it?
Nothing's confirmed yet. We can't just assume.
What, that she might have HIV or hepatitis C? She could have any number of things.
When can you come back?
And the blood tests are in.
The odds of a needle stick infection are minimal.
I just wish I hadn't sucked my finger.
You sucked your finger? Why?
What are you doing here?
We need to talk.
Press the red button now to watch Travis with the BBC Scottish